can get started so we can move into our speaker once the group is complete. I'd like to welcome everybody back from the summer. I hope you all had a good summer and enjoyed your time away a little bit and are ready to come back and do some of the work that we want to do to increase our immunization rates as our coalition is geared towards. And so, again, welcome. You all should have received the minutes in the email inviting you to this meeting. And so I'll open the floor now. If anyone has any comments, corrections, or additions to the minutes, please take a minute to voice those now. And if not, we can take a motion to accept the minutes into the record, and then we'll take a vote in the chat. So do I have a motion to accept the minutes?
Motion to accept.
Thank you. Do you have a second?
Second.
Okay, thank you. So if you could all, I think it works out best if everyone would just send a quick yes or no, approve or don't approve, or abstain in the chat, and then we'll count up the votes.
Okay. It looks like everyone is in agreement with it.
Very good. Okay, so we'll just enter those into the official record. Thank you all. And we have looks like there's 13 people. Should we move on to our talk, Emily?
Yes, I think we can, and I'll keep an eye on the meeting participants, so I'll admit people as they sign in. And we're also recording this meeting as well.
Right.
And there are just a few disclosure slides. Dr. Schwab, did you receive the updated?
Yeah, I can go through those disclosures, and then I'll introduce Dr. Jallo to the group.
Okay, great.
And as Emily said, the meeting will be recorded if anybody wants to refer to it later. And then we'll have people join as they do. Okay. So this program is titled Children's Books to Improve Vaccine Health Education and Communicate in Communities of Color. I'm Dr. Joseph Schwab, and I'm the chairman of the Board of Trustees and chair of the Essex Metro Immunization Coalition at the Partnership for Maternal and Child Health of Northern New Jersey. So before I introduce today's speaker, I'd like to review some information. The speakers and planners for this educational committee do not have any relevant financial relationships to disclose with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. There is no commercial support for this activity. At the end of today's presentation, a link to an evaluation will be put into the chat. We would appreciate your feedback, so please complete the survey. And to receive a certificate of completion for this program, including one nursing contact hour, the registrant must log in, view the entire program, and complete and submit an evaluation. Those who view the entire program and complete an evaluation will receive a certificate of completion within 2 weeks. So now it is my pleasure to introduce to you Mohammed Jallo, Doctor of Pharmacy, to speak at our meeting this morning. Dr. Jallo is an assistant professor at Touro University in California. He's been featured as an expert or advocate for evidence-based medicine, primary care practice, public health, and health equity. His health insight has been regularly featured in several large media outlets, including Time Magazine, HuffPost, WebMD, U.S. News and World Report, Runner's World, and Men's Health. He has served as primary author in various publications in peer-reviewed medical journals, with his most recent titled barber motivation for conducting mental health screening and receiving mental health education in barber shops that primarily serve African Americans, a cross-sectional study in the Journal of Racial and Ethnic Health. So I'd like to thank Dr. Jallow for joining us today and welcome him to our meeting. If you have any questions during the conference or during the meeting, I think you can either make those during the meeting or put a comment into the chat. We'll monitor that and give them to Dr. Jallow at the end. So the link to the evaluation will also be placed in the chat, and thank you for completing that. And all of those who do, I reiterate, will receive a certificate of completion. So welcome, Dr. Jallow. We're looking forward to your presentation.
Thank you for that very warm introduction. Thank you, all of you, to taking the time to learn about the projects we've done with the organization. And I hope that all of you will be able to get something from this. So this presentation is going to be about how we went about addressing vaccine hesitancy and specific health disparities in communities of color with using children's books. So again, thank you for that warm introduction. My name is Dr. Mohammed Jallow. I'm a clinical pharmacist and been an assistant professor at a university in the Bay Area for over 5 years. And I'm originally from the Philadelphia area, born and raised. But in this area, I moved to California and have loved it ever since. In addition to being a professor at my school in the Bay Area, I'm also a guest lecturer at Stanford. And I even served as an emergency pharmacist during the COVID-19 vaccine rollout. And I was helping on my days off or my time off, going out and giving as many vaccines in the community setting, just to make sure we really immunized our community. So for conflicts of interest, I have no major conflicts of interest. Pfizer and none of the big names are paying me. I am the author of the book that we will speak about, so I wanted to be very clear about that. So for learning objectives, I hope that by the end of this, all of you will be able to define what is vaccine hesitancy and why it's important, as well as review the epidemiology about this information, and then also identify what causes it. And then I want to go over some clinical studies that I reviewed that showed what people tried to do to address it in communities of color, and really describe the findings we've got from our research pilot. So what is vaccine hesitancy, one-on-one? All right, so first, to define it based upon what the World Health Organization and other groups define it as either delay in acceptance or refusal of vaccination, despite the vaccines being available, being affordable, and essentially accessible. And what we've seen, and which I agree with the World Health Organization, we pretty much see vaccine hesitancy remains a top threat in global health. We've already seen it with COVID-19, where we had a disease that was easily able to spread. And one of the ways we were able to mitigate that spread is with vaccines. But if we continue to have vaccine hesitancy grow, then when future pandemics happen, we'll be less prepared to address them. So I wanted to show an overview of this picture. So I want to make this very clear. This is not a political picture at all. It's very coincidental. Just want to be clear. So they did this study to evaluate what is the rate of vaccine hesitancy throughout the entire country. And when they looked at it down at the county or city level, they were able to see the areas were in blue were pretty much relatively low in vaccine hesitancy. And the areas in red were considered high vaccine hesitancy, such as over 30%. So I just want to make this clear. There's no political affiliation, even though people could see there is a correlation when you look at this picture. So when they did an estimate of this, they calculated that relatively there's a 30% vaccine hesitancy within our community. And that translates to over 100 million people in the United States being hesitant to receive vaccines. So what I would say are general reasons why people are hesitant to get or receive vaccinations. I think it comes from 3 tiers of beliefs or ways our bodies or minds think. I think number one, probably on the outer layer, there's probably a political or cultural influence or motivation of why you may be hesitant. Then some people, they may have some spiritual belief that does it. But then at the core idea, it's pretty much a psychosocial or cognitive belief that is really the primary reason for that. And we see that at the cognitive level, it's essentially people feel that there's a lack of confidence. There's a lack of confidence, or there's a lack of urgency, in which people get complacent, thinking, I don't really need a vaccine. I don't see measles. I don't need to worry about it. The other is lack of convenience, in which people feel that it's not available, or they don't have enough time to go get it, etc. And they don't really see it often or emphasize in the community as well. So I would say these are probably the three key categories that, regardless of whether you have a political belief or spiritual belief, it essentially boils down to people are lacking confidence, lacking urgency, or convenience. So going into vaccine hesitancy, we kind of wonder, well, why are we talking about parental vaccine hesitancy? So I'm just curious. I come from academia, so I'm going to try to make sure people are involved. Why do you think we're trying to focus on parental vaccine hesitancy versus maybe, let's say, targeting children directly, you think?
Well, parents are the decision makers for their kids, so that's really who we have to convince.
Exactly. Great point. The parents are the decision makers. They're the one who typically makes that decision. And not only that, there's certain parental figures where whatever they do as that person, their entire family will follow suit. So that's why it's important that we really try to encourage educating our parents to help not only make decisions for themselves and their children, but that could also influence communities. So here's like a picture level about what happens when people are not immunized, but still are healthy, as we've seen with COVID. When you have a group of people who are healthy and you have maybe a few, only one or two, who are sick and contagious, it makes it so easy to spread throughout an entire community. And unfortunately, that's what we've seen with COVID, as well as we've seen back in 1919 with the flu pandemic that we had. So we've seen that it's important that we really educate communities, but you can see that it only takes one or two people to influence an entire community in this sense, in the context of getting a disease. So then for me, I come from academia, so I look to see, or do we have evidence, right? So I seen there was a retrospective study that showed that there was a relatively higher rate of contracting measles. And we thought maybe it's because they got exposed to it, or they're working in an environment that constantly makes it easy to get it. And we've seen that the risk of contracting measles was actually 35 times. So not once, 2, or 5 times higher, 35 times higher among children whose parents claimed a non-medical exemption compared to vaccinated children. So we've seen that parents were the key driver, or parental beliefs was a key driver for the high rate of contracting measles. So for me, being a pharmacist and coming from academia, a lot of times people will just maybe point the fingers and say, well, what are we going to do? What are you going to do? Well, I thought, well, what am I going to do to address this? So unfortunately, I'll share with you, I did have an uncle who did pass away because of the pandemic. And it really put in perspective about what could happen in our lives. And it really showed that our lives are very limited. So one of the things I had as a dream was I always dreamed about writing a children's book. So now we have a pandemic. We have there's like this innate need to fulfill a lifelong dream. So I said, well, why don't not only I fulfill a dream, but why can't I help my community as well? So one of the things I did was I self-published this children's book called Andre's Armor. And what it does is explain the mechanism, the safety, and even the approval process, the FDA approval process of vaccines. And what I've learned is I thought this could be a great way to not only express my passion, but also help our community be more educated in their decisions about vaccines, so they may be more inclined to receive them. And what I've learned is if you try to use all that medical jargon, parents are not going to listen. So I use like knight, monster, and armor analogies to make it easier, and I try to make it a little bit fun. So I try to make it rhyming in nature. And what I designed it was that it's not easy enough for a child to read. It would actually be a parent who would read. So the goal would be if a parent reads this, then they themselves can have an improvement in the understanding about vaccine. So then they can help make that decision for not only themselves, but then for their child as well. So to give like a quick like preview, the story centers around a kid named Andre who's scared to get vaccines, and then he has a doctor who looks like him explain how vaccines work, but using like analogies. So here's like a preview where she's drawing on the exam table or on that paper, and then trying to illustrate what is going on when you receive a vaccine. And here, if you take a look at the picture, you'll see that the people who look like him are wearing the white armor or his white blood cell knights or his immune system fighting against the monsters that are there or the germs. And the green thing is the armor that the vaccine has provided to them. So that's just the idea of the story. And when I initially came out with this book, at first it was more of a passion project. But then when I was at my clinic giving it to my patients as well, a lot of parents were saying, oh, well, wait, that's all that's it to it? Maybe I should get a vaccine then. And I started seeing parents are saying, okay, I want to get a vaccine. I want the armor too. And then started children were telling you, hey, mom, I want to get the armor. I want the armor. So it wasn't even simply, I want to get a shot. They were like, I want to get that armor to be cool. So then I was lucky. Emily reached out, heard this book, and then highlighted like, hey, we want to do something to help address hesitancy in our community. So then as we've been working together and she's been getting a lot of these copies out in the community, a question came up, does this really work? And so a question came up of, could Andre's armor be used to address vaccine hesitancy in our community? So coming from academia, I wanted to make sure we were pretty credible in the study design. So what we did in the study design was we had it was a live online or in-person reading session. And it was like a single arm, just meaning a single group of people. And it was a pre and post design, meaning we would do a survey at the beginning, do the intervention, and then survey at the end. So the patient population, we were looking to get at least 50 parents who are at least over 18, has children, and their children are people who would get a vaccine to see, does this really work? And in our intervention, what we did is we did an evaluation of vaccine hesitancy using that score tool. We gave the intervention of the book and the presentation, and then afterward, then we gave the score again to see did it have an impact. So as a background, the PAC V5 score is like a validated score tool to assess and actually quantify vaccine hesitancy. And it does a good job of quantifying it where you can get to a scale of 0 to 10. Now, they have other iterations of this, but we figure this will be pretty quick, where it's only like 5 questions to quickly assess someone's hesitancy. So at the score level, if anyone scored less than a 5, that would suggest low vaccine hesitancy, meaning they're likely compliant. And anything greater than 7 would indicate higher hesitancy. And this is based upon the validation study that they conducted. Now, with the intervention, what we did, we had gave them the book and we did the reading with that. We also had a CDC paper that was available, and we even had a presentation that was there that just reemphasized some of the material that was in the book, just so people had another way of absorbing that information. So for the preliminary results of this study, it was pretty cool. So we had, again, live online or in-person reading sessions. We had over 91 people who were able to complete the survey. And this is like 91 people where we were able to do the pre, but then after trying to match them up with the post evaluations, and we've seen, of course, people were trying to duplicate things, we were actually able to get to 50 people who had credible information. So of those 50 people, here's their evaluation. Average age we've seen was around 40. They had an average number of children around 1.86. And I was surprised, majority of the people who completed the survey were married, 53%. And as you can imagine, over 86% or majority were mothers. The average age of their youngest child was 3.5 years of age. And I was actually pretty excited to see that a majority either had a high school diploma or some college, which was pretty good to show that people were really educated in our community. Now, at the demographic level, specifically at the race level, we would say majority were Hispanic, Latinx, or Cubano. And then the next group after that was Black or African American. And we had a small amount who were mixed. And then we had the others that were Asian and Caucasian. So for the big reveal, I want to share some good news that majority of parents who participated in this had an improved score, meaning they were less likely to be vaccine hesitancy. So it was pretty exciting to see that. Coming from like academia and public health, I was not expecting majority. I was expecting maybe 20% would be an acceptable number, but to have over 56%, I was pretty excited and ecstatic to see that. So to give a quick overview, we had over 56% had an improvement in their vaccine hesitancy. Then from there, we had on the opposite end, only 16% actually had a worse. And when we seen worse at the point level, it was only by 1 to 2 points where they were. So it wasn't by a big amount. And regarding no change, surprisingly, we've seen 28% of the participants had no change in their vaccine hesitancy. And it was interesting that when we looked at the people who had no change, majority of them were people who were absolutely hesitant at the beginning. So when they came in absolutely hesitant, their number did not change. So it was pretty interesting. And then the other flip side of it was there were people who were pro-vaccines at the beginning. So when we tested them at the beginning and after, they were pretty much the same. So when we seen the no change, it's pretty much was at two extreme levels. Either people were for vaccines and they didn't have a change, or they absolutely did not like vaccines from the beginning and there was no impact. So it was pretty much on both extremes. The interesting thing was the race group who had the most improvements was the African American or Black community in this population. So it was really exciting to see that. So then when we took a look at the data as well, when we looked at the average score, we seen that the PAC V5 score on the people who completed the pre-analysis, we've seen that the average score is around 5.32, and in post, it was around 4.2. So that was like the absolute difference between the two. So to give a quick discussion, I would say overall, Andres Armour was shown to improve vaccine hesitancy in majority of the sampled mothers or in the community in New Jersey. Now, this kind of aligns a little bit with previous research as well. So when I was doing a review of other research, I found that there was another study in which they conducted a rapid survey of 325 mother and infant pairs. And they really wanted to assess, was there a relationship of having just basic access to maternal and child health books and just complete immunization coverage in rural areas. And pretty much the book was defined as just basic information. So it wasn't like a children's book. It was just basic information you may find at a pediatric office. And in this study, they found that there was a positive correlation with ownership of the books and completion of the basic immunizations in this country. And then in another study they conducted in Europe, they did a study where they evaluated 484 women. The average age of them were 30 years of age to really assess the impact of a single educational lecture on vaccines, specifically on vaccine hesitancy in 11 large cities in Poland. So this was one of the studies we used as a reference point in which they did the same single arm pre and post design. And what they did is they already had community education meetings. And then during the certain amount of these meetings, they would have an education vaccine lecture. And they made sure that it was a pediatrician who delivered it, who had experience with vaccinology. And when they did this study, they found that there was a huge improvement in vaccine confidence and knowledge of vaccines after the parents conducted the educational session. So you can see these were the key studies we've seen that correlate with our results, and we use as a reference for designing our own study as well. Now, even though we found some good data, I will be very clear, there is always limitations in studies. So number one limitation people may highlight is that this wasn't a randomized controlled trial. As a refresher, randomized controlled trials are the gold standard for interventions to see if an intervention is truly effective. Now, one thing to keep in mind is this study could be a precursor for a actual randomized controlled trial or a cluster randomized trial to see if this intervention works at that grander scale. The other question or other comment that people brought up is saying, hey, we didn't really see, did it really have an impact on the immunization record? And this could be really good guidance for a future study to see, does it really have an impact on people getting the vaccines? Because we really just studied the perception of vaccines but we didn't really study, did people actually get a vaccine after the fact as well? The other question people may bring up is the sample size calculation, saying, hey, this was a small sample size, and that's always a big limitation. And I would say this could be a good precursor for a future study where we could calculate the key sample size and do a larger study to show the true impact. But I was really excited to see that we were able to see a difference even at the small level. So again, as a conclusion, vaccine hesitancy is defined as the delay or acceptance of, or even refusal of vaccines, despite it being available, affordable, or in your community. And we've seen that a lot of parents are hesitant because they don't feel confident in them. They don't really have that sense of urgency, and people feel maybe it's not convenient for them. And I think this book is a novel and inclusive book that can really improve vaccine hesitancy in our communities of color as well. So to give you some great news, we already started a new project with this, where we were able to convert this children's book into a video now, to make it easier for people to have access to it. And we're working with some of the students working under Dr. Pinete or Liliana about this to see how can we do this, use this video in the, I believe, home care setting, where we have women who are, I believe, going to be delivering soon or going to be having a baby soon. And there's home nurses who are doing home visits to assess these parents. And we're going to see, hey, if we give them a video of this book, and video which pretty much goes over the book and just goes over the story, does that improve not only their vaccination or immunization status, but then their immunization status of their child that they're going to likely give birth to? So I thought this would be a cool, pretty exciting to show that we are not just stopping at this one project, we're actually continuing to develop. So I just want to say thank you again to Emily, Liliana, Melissa, and Jasmine who are on the line. I believe all of you have been amazing advocates. And I just want to say thank you again to try to help our community in New Jersey. And I also want to help our students that we've had under this program, where they helped with developing the structure of this project and helping to write the IRB, as well as even helping to conduct the study. So I just want to say thank you again for all of this. And I really want to give a shout out to Emily. She's the one who reached out initially to start this. So I just want to be clear, if it wasn't for Emily, we wouldn't even be here at this level. And we probably would not have improved some of the vaccine hesitancy as much as we did in the community. And I hope all of you see the impact of that by us improving the vaccine hesitancy in just even one family, that really could have changed the trajectory of an entire family for their entire life. So I just want to say thank you again, Emily, for really reaching out and being an advocate for this. So with that, that's all I have for today. Does anyone have any questions?
Thank you, Dr. Jallow. That was a great presentation. And I think you touched on a subject that's really near and dear to our hearts, and really the focus of a lot of the work we do here is overcoming that hesitancy to increase vaccination rates. And I've seen and read through this book myself, and I think it's terrific. So I thank you for developing it and for offering it up for our use, and for Emily and Liliana for connecting us and getting it hopefully out to a wider audience in our community. So I appreciate your time. And again, I'll second that. I'll open this up for any questions or comments that people may have.
I do have a question. Thank you so much, Dr. Jallow. This was a great and continue to be a great collaboration with you and with the students, and our last year students and the current students who are going to get engaged. We have good news. I think you might have seen that National Office for NFB approve our research, so we'll be following up with you and moving forward with that project. And really this great collaboration, for the community, for education on immunization, but also engaging students who are our providers, future providers, right, that they are getting involved with this work during their studies. And I think we have one of the students here, Dana, who is looking for the results, and here are the results. Those are all exciting for us. I had a question about that 16% because it bothers me that it worsened, right? And you said there were just a couple of points, and I think, 16% of the 50, there might be about 8. Mm-hmm. So, and I know we have Jasmine here as well. I'm just wondering, I don't know if we can speculate or have any insight on why they would, decrease their knowledge, basically, or awareness.
That's a good question, and I think we can come up with a lot of hypotheses about why. One of the data points I noticed was one of those people who tried to double dip. There was a lot of people who actually were trying to submit multiple surveys so that they can likely receive multiple gift cards. And it was surprising that I seen a couple of those where it seems like they may have ulterior motives for conducting the survey, and they may not have realized that. So I just want to put that in disclaimer. And the second one, I can remember when I was going through the data, it looked like there was most of them were only decreased hesitancy or improved hesitancy, or I guess it was worse for only by 1 point. So it wasn't that people were going from 0, which would be non-hesitant, to all the way to 8, which was the extreme, or to 10. It was all by 1 point that would happen. But I want to be objective and say we technically did have worse, but it wasn't by multiple points. It was typically by 1 point.
And thank you, Dr. Jallow. And I wanted to give a few minutes to Jasmine Anderson as well, our program specialist and education specialist with the immunization initiatives at the partnerships, who conducted the workshops with the parents, to tell us more about what those workshops were like, and how you went about, engaging parents and conducting the workshops, just to give a little bit more insight to our coalition members about how this project was rolled out, and then we can have more questions as well.
Yeah, absolutely. Thanks, Emily. Hi, everyone. As Emily shared, my name is Jasmine Anderson. I'm an immunization education specialist for the Immunization Initiatives program at the Partnership for Maternal and Child Health. And so I had the pleasure of actually executing the parent groups. And so I guess in terms of how I decided to execute it, it really took a lot of me doing my own homework. And so just reading the book myself, and immediately I was really drawn to the prose and as well as the illustrations. And so that kind of sparked my own passion behind it. In addition, I have a niece, and so reading a children's book to an audience wasn't an issue. And so I kind of tapped into that when I was reading the book with the parents. Either parents were there by themselves, or their kids were there as well. Either way, I still read it as if I was reading, to a child. And it seemed overall parents just had a very positive response to the book. It seemed that a lot of them were pleasantly surprised by it. I actually got an applause on my last reading of it. And I don't know, I don't think it was me. I really think it was the book that really drew in the parents and really explained how vaccines work. And it was very captivating in that sense. And then I do recall this one instance where a mom came in staunchly against the COVID vaccine. And after reading the book and, going through the presentation with me, I slipped her our COVID pamphlet, and she was like, okay, I'll take a look. I'll read it. I won't say no just yet. And so for me, that was something that made me feel good, and it's really stuck with me. And just to see what the impact of the book was. And as I mentioned, the prose, the rhyming, and the illustrations are absolutely incredible. And I just have to, tip my hat to Dr. Jallow for sure. But yeah, overall, parents really enjoyed the book. Kids really loved it as well, but the parents were overall very receptive.
So thank you, Jasmine. I had a question for Dr. Jallo as well, if you don't mind sharing a little bit about, I know that out in California, this was also used in clinical sites. So I don't know if you could share a little bit about how it was used at a clinical site with parents or families.
Oh, thank you for that. So to give you background, a county actually reached out and they actually had a bulk order to try to distribute to every child within the county in California. And what they did is they had clinical sites that they were affiliated with. So the county purchased them and then delivered them to the clinical sites. And then during the mass vaccination days that we had throughout here, while people were waiting in line, they would hand out the books that way. And they did that just to ensure that people were encouraged to understand about the vaccines before they got that. So that's typically how they went about it. There was a big purchase, and then they were going to different clinical sites and dropping off the books. And then the clinical site would then distribute them in their own event that they had.
Thank you. Leanne, I know you had a question.
Yeah, I was curious, Jasmine. I know you did virtual, you did in person, you did libraries and daycares. You reached out to the public in different ways, and I'm wondering what was successful to you. What did you find was were the most effective ways to get to people?
Yeah, the greatest turnouts that I had were with either family success centers that already had a captured audience, or some of our in-house programs at the partnership that already had a captured audience. I realized that that was something that was important because the times when I tried to host at like a library, turnout was low, and I'm wondering if that's because of vaccine hesitancy just in general in our communities of color. And so I was trying to figure out what would be the best way to still tap into parents, get to the parents, but to the parents that were, I guess, willing to talk about it or share their opinions, or at least sit and listen to a presentation. And so I guess when I'm walking away with is, well, how about those parents that are still very much, you know, they're anti-vaccines for whatever reason. Is there any hope in that sense, or is there any way to reach them? So it definitely was it was interesting. It definitely was a mixed bag, but I definitely found family success centers were my most successful ones.
I have a question for Dr. Jallo. How do you think that we could, I mean, you talked a little bit about following up with immunization rates and looking at, actual vaccination rates. But we know, just from talking with pediatric providers and public health nurses, that sometimes it takes like several interventions or several conversations with the family about vaccines for them to change their mind or to move forward with vaccinating. So how could we address that aspect of it in a study where they may not be ready right away after that first intervention, or in their post-test they may not show that they've changed their mind, but maybe there's a follow-up conversation with a pediatrician, or we know that it's a collective effort as a coalition that, we're all trying to improve vaccine confidence in our community. So if you have any insight into how we could find what other measures could help complement this with families.
Oh, that's a good question. I think one measure you can consider is quantifying or documenting the type of intervention you do, and then just seeing if it's consistent. For example, you can assess at, let's say, baseline, when you meet a parent, you can document, was there any intervention related to education for vaccines? And from there, just keeping track, is that consistent, for example? So, for example, are you giving that pamphlet consistently? Or are you consistently engaging with them about vaccine hesitancy? And then each time you're using a different intervention to do it. So maybe the first time you meet with them, you're just simply giving them a pamphlet. The next time you meet with them, you're speaking to them for 5 minutes about it. The third time, then you're giving them a children's book. The fourth time, maybe you're giving a video. So I think one thing to consider is an option is that of, do you want to quantify the interventions you do? And then at the other level, you may want to take it at the multi intervention approach where you're consistently giving multiple interventions at the same time. So the other option would be, do you, at every visit, are you consistently giving them, a pamphlet? Are you consistently giving them a message about it, or a children's book about it, or some type of education pamphlet? And seeing if you're fulfilling all of those metrics at each visit. That could be another option as well. So I think those are ways you can consider not only evaluating, but measuring what are you doing. And I think one way is just measuring, the intervention you're giving and categorizing it and quantifying it, and almost making it almost like a standard of care of saying, hey, at each visit, did we do this or that?
Yeah, I think, Emily, your question is right on target, and thank you for that answer. I think, multiple interventions at different times and even coming from different places. So using this same intervention, but having it delivered at a school, in a community center, in the doctor's office, would really reinforce the message, and it would show that it's supported by different parts of the community. So it makes the message more reliable, I guess, or more believable. I had two questions. First, so I know you said this is self-published. How expensive is the book if other people wanted to use it? And second, I haven't seen the video, but how long is it? And could it be something that would be available to integrate into like a waiting room programming on a TV as like a public service message that's delivered a few times, or even played in the patient's room if it's short enough, while they're waiting for someone to come in to be seen for a visit and maybe get vaccines?
So yeah, I could answer your second question. I may ask you to repeat the first one, but your second question, it is around like 5 minutes. I believe it's like 5 minutes and like 20 seconds. I don't know the exact number, but it's relatively short. And you're all right. It could easily be played like in the waiting room, etc. The good news is, it's already published and we have it in English. We are in the process of continuing getting it in Spanish, but the English one is already available. And I wanted to make it very inclusive. So I had a African-American woman narrate it as well, so people can really resonate with that voice as well as a child. So we do have that video, and yes, it would be able to be played either at the waiting room or simply even at the iPad level. And now, can you repeat the first question again?
Yeah, my first question was just how expensive are the books to obtain if people wanted to use them in the practice?
Yeah, so what I've worked out is I give like bulk discounts because in certain cases the books can be expensive when you're purchasing only like a few amount, or when I get them printed out, I'm able to get the prices. I'm able to negotiate with the printer to get the pricing low. So to give like a relative estimate, prices can range all the way from like $3 to $5 all the way up to $20, depending which printer I use and the quantity I order in.
Thank you.
Oh, you're welcome. And this is per book, to be clear.
Yeah.
And we do have some available copies as well. The Department of Health and Vaccine Preventable Disease Program supported the partnership through funding to purchase copies of the book through our immunization initiatives. And so we do still have copies available if there's any coalition partners that are interested in working with us to, distribute it to families, either through events or, through an office or clinic setting. You would just reach out to Jasmine and to help coordinate that. So we have it available in English and Spanish as well.
I do have another question about the Spanish version, right? So we implemented only in English, but there is a Spanish version, which I think it's very important, especially, when we look at language barriers, right? And, providers, educators might have a challenge to provide that education, and the book, it's there, that the education is there. Do you have any recommendations about how to integrate? I don't know if we could, continue to provide those educational sessions. Jasmine and Emily could update on that, but any suggestions about the Spanish versions and how to use those?
Yeah, so to clarify, we already have the book already translated, not only in English, but we have it in Spanish, Hindi, and Portuguese as well, and even French. So these are all available in the print form. So this is, I think, one way to engage with it is having the Spanish version available and letting people know it is available in that. The second is having someone who does speak Spanish do the reading as well as the presentation. I think that would be helpful, and it'd be helpful if someone is very native in their Spanish speaking, or at least has like a good understanding. Like for me, I am fluent, but I know I don't have like the native tongue as well as other people do. But I would recommend that I'm using the translated version and then having someone who is Spanish speaking facilitating the education session to hopefully make it more resonate with the community.
Thank you. And, one option for us, because Jasmine mentioned her success at the Family Success Centers, it's to integrate the use of the book with, we have a program called Early Childhood Literacy, and that's actually, we focus on, literacy, and this would be a book with purpose, right, to educate on a specific topic, and that could be integrated, within their activities at the Family Success Centers. And we do have staff who are Spanish bilingual, and they could use the book actually in their workshops with the parents at the Family Success Centers.
And to clarify too, we kept it in rhyming nature as well. So we were even able to make it rhyme in Spanish. And the irony, it was actually easier to have the words rhyme in Spanish than in English. So just make sure it's very engaging in that way.
Thank you. That sounds great. Do we have any other questions or comments from the participants who are online? And I do see also that Emily posted the link to the evaluation. So for those of you who are seeking nursing credits for this, you can follow that link and fill out the evaluation. And actually, everyone's welcome to fill in an evaluation. I'm sure Dr. Jallow would appreciate the feedback as well. But I think this was a great presentation.
Thank you for that.
Big question. Can we have a PDF of the slides, Dr. Jallow, to send to Emily? Yeah.
Yep. I think I sent a version, and I think they should be able to. But if you need me to send it directly to you, I'll be happy to as well.
Thank you. I will be in touch with you. Yeah.
Yes, I have a copy of the slides that I can share with everybody that joined today.
Thank you.
And I think that maybe there will be more people that watch the recording. We had 48 people register for today. So I think there was a lot of interest in the topic. So I'm expecting that people will be watching the recording as well.
Okay. All right. Well, thank you very much. I guess if there's no more questions right now, maybe you can also send, or Emily must already have your email address. We can forward you any questions that come up. If you'd be able to reply back, that would be helpful as well. But thanks for joining us today. I really appreciate it.
All right. Thank you again for having me. And again, thank you, Emily, for being a great advocate and really starting this. So I just want to say thank you again.
Thank you, Dr. Jallow.
Okay, so we'll move on now to the next section of our meeting. We have about a half hour left. Emily's going to be leading discussion from our two working groups, and thanks, Dr. Jallow, for joining us. So I'll turn it over to you right now, Emily. Thanks.
Okay, thank you, Dr. Schwab. I will share my screen to give some updates on the community education working group. So For those of you that are new to EMIC, we have 2 working groups that meet quarterly as well in between our larger coalition meetings to discuss initiatives that are happening in the greater Newark area and Essex County. And since our last meeting in June, August was National Immunization Awareness Month. And so the team here at the partnership did a lot of great initiatives for Immunization Month to provide education in the community, and also to providers as well. So online, they did Tuesdays with the team and had a different topic shared through our social media pages, and that had a really good response to it. Our community education working group members also wanted to make sure that we announced at the meeting to remind all of those working with community members and publicly insured populations that it is important to discuss Medicaid renewal reminders with families, because we don't want families to be told that their Medicaid insurance has lapsed when they go to seek care, which would become a barrier for them in accessing well visits or any care, and especially in immunization rates. So we don't want a parent to come to an office for an appointment, bring their baby or their child to get vaccinated, only to find out that they are no longer covered because they didn't fill out the paperwork for their Medicaid renewal. So it's really important and something that we can do to remind families to pay attention to their mail if they get something in the mail from Medicaid to renew, that they should, fill it out promptly and return it, and that there are resources available as well to help them in that process. Also, throughout August, we provided other professional education workshops, and I put the flyer up here for one of them with Dr. Kamara, who is a pediatrician in East Orange. And that session was really very well received. And Ureni Syme from the partnership actually was the moderator for that. And it was a joint collaboration with the partnership and Screen NJ, which is Cancer Prevention Education Initiative. And they discuss HPV, common questions that patients have about HPV, and it was a really well-received webinar. So that's also recorded and available for anyone who missed it the first time. We also have an RSV Q&A session that was recorded and available for professionals about the new RSV monoclonal antibody, nirsevimab, that's available for infants entering their first RSV season. So that is posted. It was an initial presentation from the medical science liaison at Sanofi, and I think it's very helpful in answering some questions. We had a lot of interest from pediatricians about that Q&A, and it's also recorded if you missed it or want to reference it again. We also started a new traveling program, which is a collaboration with New Jersey Immunization Information System and our HPV Cancer Prevention Initiative. It's a traveling program, and I don't want to put anybody on the spot, but if Melissa or Ureni, if you want to, or Leanne, if you want to share any information about how that's been received at the offices, I think that would be helpful.
I guess if Melissa is, and Ureni, you're spearheading it, but I can say that it's been a pleasure to talk to the HPV community. Teresa Rowe and I have done a couple of presentations at doctors' offices. We've done them virtually. We've gotten some great questions about NJIAS, people wanting to enroll new NJIAS users. It's been great and something new and exciting.
Yeah, I think it's a great presentation, a great way to bridge that gap. So we had the opportunity to speak about HPV and the vaccine and recommendations and offer that education, as well as having that NJIAS piece, which is specifically focused on how you can run these reports to increase your immunization rates for HPV vaccine. So I think it's a great collaboration and a great webinar to be able to provide.
Great. And it does offer professional nursing credits as well for staff that attend, and can be offered virtually or in person at a pediatric or medical provider office. So we also have a new traveling program discussing motivational interviewing that is presented by Melissa Hart, and Melissa goes over how to utilize principles of motivational interviewing to improve vaccine confidence and improve vaccine uptake in patients. So that's another available traveling program that has professional credits as well, and that could be done virtually or in person. Looking ahead, we've been working as a working group to plan several upcoming flu events. We have one coming up quickly on September 30th in Nutley with the health department there. And this is our first inclusive vaccine clinic that we're going to be hosting, that follows up on what our initiative was in April with the Autism Society of America in offering accessible vaccine clinics. So we were excited to see that there were several local health departments within Essex County that took that training back in April and expressed interest in hosting accessible vaccine clinics for neurodiverse individuals in the community. And so now that flu season is here, we are excited to see that we're able to put it into practice. So this will be the first one that we're conducting, and the Nutley Health Department is taking the lead on coordinating that event. We'll have people there as well. I think last week they already had 50 people registered for it. There's a pre-registration process as well. But we're anticipating between 50 to 100 participants. That's what we're thinking will be the turnout. It's a Saturday, and we're going to see how it goes. It's our first one that we are hosting in terms of an accessible vaccine clinic, and we've been working with the Autism Society of America to make sure that it's going to be a good experience for those who are neurodiverse, and have been promoting it as well to schools in the area that are serving neurodiverse students. So that parents are aware that if they'd like to bring their child, to receive their flu vaccine at this clinic, that, there will be, special accommodations there for their child. So we're excited about that event. And we are also currently in process of working with the Unity Family Success Center in Irvington to plan another trunk or treat event in October. And with that, we're also looking to provide community flu shots as well for the families that attend. If there's anyone on the call that is familiar with or willing to put us in touch with vaccine providers in Essex County that are willing to come work at a community flu clinic, we are very interested in collaborating. There's a lot of community flu clinics happening. And so, we're looking for new partners, new pharmacies, like local pharmacies, pediatric providers that have access to ordering flu vaccine and have staff available that can come to a community event and vaccinate. There's been a lot of interest from schools they want to have school-based clinics. There's a lot of interest from community-based organizations, faith-based organizations. The interest is there in having community events, but where we need support from the coalition members is making sure that we can put those community-based organizations in touch with the vaccine providers and that have flu vaccine. So, and have the staff willing to come out on a weekend to vaccinate. So if there's if you know of anyone and have any ideas, please share that with us so that we can work on helping to coordinate those efforts. And for the community engagement working group, some updates on the current status of the coalition. So we have 155 current members. and 434 newsletter subscribers. So we are, there's steady growth every quarter in terms of membership of the coalition and the newsletter subscribers. For the Protect Me with 3+ campaign, that is starting up again. So that is a statewide video and art contest for 5th through 12th graders to learn about the vaccines that are recommended for them and to submit their artwork for a chance to win prizes and to be featured statewide in public service announcements. So Melissa Hart is overseeing that campaign along with New Jersey Department of Health, Vaccine Preventable Disease, and we'll be sharing the flyers with the coalition as well to help get the word out. And the Step Up Backs Up contest for college students is also opening up in October, and they will be accepting contest submissions on other topics, other vaccines. So we have COVID-19, flu, HPV, and the meningococcal vaccines as well. And the staff from the College Health Awareness Campaign, they also are going out to college campuses already. They started back in September. They've already been going to campuses and doing some presentations with students to educate them about the importance of vaccination. We also are starting up the flu campaign for the Power to Protect New Jersey and the Influenza Action Group. So if there's anyone that is interested in joining the Influenza Action Group, there are several. You'll receive a monthly newsletter to update you on flu activities and resources in New Jersey every month throughout the season. And you'll also be invited to professional development opportunities to learn more about flu and flu recommendations, as well as be receiving resources such as the Power to Protect New Jersey toolkit to help spread the message that families should be receiving flu vaccine for everyone 6 months and older. And there's also 2 immunization conferences coming up. The Department of Health asked us to share information about the Back to School webinar that's being hosted on September 27th at 2 p.m. And there's also an adult immunization conference on November 1st. And I'd like to acknowledge that Melissa Hart will be presenting a session at that as well. So we're very excited for that. And I don't know if... I don't think Esme's on the call, Dr. Schwab.
No, I don't see her on, but so just a last plug for both of the working groups. Again, anyone who's on the call and hasn't joined a working group certainly would be welcome. That's where a lot of the obviously work takes place, and it's opportunities to kind of get into the community and into some of the projects that the coalition is working on and contribute your expertise as well as your manpower, woman power to make things happen. So, and for those of you who are viewing this online as well, feel free to reach out to Emily and sign up for one of the working groups. So before we go into announcements, well, we can do both, but do we have any new members? I neglected to do this at the beginning of the meeting. We traditionally introduce ourselves. We have a pretty small group today. Are there any new members on the call that would like to just share who they are and where they work or what organization they represent?
Hello, everyone. My name's Kimberly, and I'm from CMS, and I'm a health outreach specialist. So kind of been like a silently creep in the background at a couple of your meetings. So I'm usually in transit, but happy I've been able to sit in here and pop in and hear about a lot of the great things you all have going on, especially with the vaccines getting out there. I'm a pharmacist by trade, so happy to hear about anything people getting vaccinated and being safe and preventative medicine. So yeah, I'm happy to hear about that. And I'm through the Inflation Reduction Act, so even for like the elderly populations. Happy to provide information about that. But yeah, happy to be here with you all.
Thank you and welcome. And we'll be reaching out to you for information. So
awesome.
Thanks for joining.
Hi, everyone. Forgive me for not being on camera, but my name is Milka Rodriguez. I'm a medical science liaison with Moderna. This was a really great session. It was wonderful to hear about the book that Dr. Jolloff is writing and so many efforts to get the community vaccinated. So I am the medical science liaison for Northern New Jersey. There's another medical science liaison that covers South Jersey, Medina Gazanfer, but I'm a resource for clinical information about Moderna's COVID-19 vaccine and any updates to the vaccine.
Thank you, and thanks for joining us. Appreciate it.
Could I take the since we have a few minutes, I'd love the opportunity to ask Kimberly, actually, one of the questions that came up on the working group call or concerns that we were hearing in the community was regarding the new RSV vaccines for older adults. And if that is covered by Medicare, Medicaid, and some reports that some of the older adults are being charged a lot of copay for Medicare Part D when they're going to get it at the pharmacy. So if you had any insight, we had all of the working group members were going to try and find out more information about it. But since we have you on the call, maybe if you have any information to share, that would be great.
So for the RSV, so let me take a step back. So the Inflation Reduction Act will cover vaccines that are recommended by the ACIP. The RSV was just newly added in. So if you had some really excited people who got it really early, then yeah, that was before we added that on there. But as of now, RSV is included and covered at zero cost for vaccine coverage. Yeah.
Thank you so much for clarifying that. I think that will be very good news for older adults that are looking to receive it.
Oh, yes. And then for COVID, as of today, the 20th, people can get their shots. I know people have been like, I want the new one, and like the 20th on. So, yeah. Any other questions? Oh, yeah.
Any other people that want to introduce themselves?
Hi, yeah, it's Ureni. Emily, sorry, I know you called on me. I had to step away for a second, but I'm Ureni Simon. I'm the Public Health Program Coordinator under the Immunizations Program at the Partnership for Maternal and Child Health of Northern New Jersey. And thank you, Melissa, for sharing my experience with the NJIS and HPV presentations to clinics.
Thanks. Okay, and then also, if anyone else would like to introduce themselves, or if you have any announcements about any of the happenings going on in your agencies or community events that are going on, you'd like to announce now, please feel free to unmute and share those with the group.
I'll go. I'll remind everyone about the Docket mobile phone app. That is an app anyone in New Jersey can download onto their phone, and it connects to NJIAS. So it gives you your proof of vaccination. So as long as the vaccination is in NJIAS, it will show up in Docket. And that includes the new RSV vaccine. All COVID vaccines are in there. And as long as the pharmacies and the doctor's offices are participating, your flu shots will be in there. So historical vaccines can go in there as well. So Docket mobile phone app, great resource.
Yeah, thanks, Leah. Do we have any other announcements, or anybody want to share anything with the group? Did you have any comments, Emily, before we close?
No, we're in the midst of planning the flu clinics for October, and I know we have some on the calendar already for late September and October. We're looking to schedule some in November as well. So it becomes a very busy time of year, but we're always looking for collaborations, with our community partners to host community vaccination events, because we know that if we can improve access and make it more convenient for people to get vaccinated, then it's more likely that they'll get vaccinated. So that's something that we really try to focus on for the fall.
Great. Okay, well, again, thank you all for joining us. This was a great meeting, and I'm happy to see everyone back for the new year. So we'll keep up the good work, and you'll be receiving the newsletter from the partnership. So feel free, if you do have any other announcements that you'd like to share with the group, send those in, and Emily will post them as well on the monthly newsletter so that those can go out to the membership. I think we have over 100 people now on the mailing list, and those represent large parts of the community. So you can get the word out that way. And our next meeting will be next quarter in 3 months. So we'll look forward to seeing you all again.
December 6th.
December 6th. Great. All right. Thanks. So the details will come out. And then again, if you want to join one of the working groups, we'll be in touch even sooner. Have a good afternoon, everybody. I appreciate it.
Thank you, everyone.